Hello, everybody. I just wanted to make sure to click record. I'm using a new computer system today because my last one is having some technical difficulties and I need to do some major updates, which is going to take hours, but I don't have time. So I figured that I would do something a little bit different. So you might notice a change in the background. I finally have some new shelves for my office, finally. I'm painting next, so you might notice some marks on the walls, but just don't pay any attention to those. But more importantly, so I wanted to do a video to talk to you guys about the recent events of a report coming out that there's no evidence that flossing actually works. So for any dental professional out there, you're probably thinking, what? What is next? And unfortunately, patients will see this and patients will read this, and because we all know those people who believe that everything on the internet is correct, right? So we know that patients are going to come to us and say, so about that recent article that there's actually no benefits in flossing, you're telling me to floss. Well, if there's no benefits, why am I doing it? So I'm going to talk to you guys today about how you can kind of do some damage control with your patients. Now, this did come out last week, I believe, and I haven't actually had any questions about it from patients, but it could happen. So what I suggest doing is just, you should never act unprofessional, and you should never say that's ludicrous, that sounds stupid. Of course, there's benefits to flossing, or why would I be doing it? If there weren't benefits, why do I do the job that I do? So whether you're a dental assistant or dental hygienist or a dentist, you need to talk about the benefits of flossing. And how I would normally start things off is by basically saying, I see what happens from those people who don't floss. They lose their teeth over time because if they're not flossing, they're missing all of those areas in between the teeth. And if you think about it, that food, that bacteria, plaque harbors a lot of bacteria. If you're leaving it there, it slowly starts to eat away at the teeth and the gums also, and that is when there's problems. And you want to tell your patients that you are here to help them avoid any problems whatsoever. So that's why it's so important for them to come in to have their teeth cleaned, for them to come in to see the dentist, for them to come in to see you. And that's why you do always say to brush and to floss, because your toothbrush isn't reaching those areas in between the teeth. So this study makes no sense. Just between us, off the record, the research was done poorly, because how could they have found that flossing isn't doing anything? That doesn't make sense, because we know that flossing is so important. So just a couple things that, you could be saying to your patients, because what's next? They will be telling people that brushing doesn't actually help things, and that if you brush every once in a while, that's okay. We'll tell that to those people who have so much plaque, so much tartar, that when they come in to see us, they're in pain afterwards because there was so much for us to take off. Or tell that to those people who have lost most of their teeth from not brushing and flossing. So just remember, you still have to be a professional. We all want to say that article is stupid and dumb, but, try to be nice and try to be positive for your patients, and just pretty much say to them that you see what happens when they don't floss. The gums bleed a lot. The gums could become painful. The teeth could become painful. There's a greater chance of getting a cavity or more, because if they're not cleaning the plaque that's in between the teeth every day, then that plaque, bacteria, keep on mentioning the word bacteria because it's true. And patients, when they hear that, they think, oh, and what I normally tell them is that if the gums are bleeding a lot, that's a sure sign of somebody who's not flossing every single day. Now, if you had a cut on your arm or your hand or your cheek or something, and the cut started bleeding a lot, you would be concerned, right? You would be very concerned, and you would be very worried. So it should be the same thing in the mouth too. As soon as they see that the gums are bleeding a lot, they shouldn't think nothing of it. They should be very concerned, because that's not a good thing. So just a few tips for you. I do hope this helped. If you need anything, just email me anytime. I am always happy to help. I talked to my students about this last week also, because we need to keep up with the current events that are happening, because patients will have questions. Okay, everybody, so I will see you guys all in the next video.